So thank you so much for joining us today. We're really excited to host this webinar and put this venue together for all of you. I'm your host and moderator, Manuel Kingsley, and we're here today to really talk about how to navigate this last leg of the pandemic, making sure we keep employees safe, businesses open, especially as we return to more in-person activity, the full operations. And kind of, make sure we were successful in this last piece of the race, to say in a way. The pandemic really created a number of issues. Of course, it's kind of an understatement for everyone. But I have to say, the business community in particular had a lot of challenges. They needed to continue to serve their clients. They needed to keep their employees engaged and healthy as they adapted to kind of different circumstances. They had to adapt their businesses to the new realities as well. And really, I'd say ultimately really keep their businesses afloat, and in some cases actually dramatically increase the amount of service and products they provided because there was a growing demand just based on changing circumstances. So I'm here on behalf of Project N95, and this is a strategic partnership between ACCE and Project N95. For context, N95 is a non-for-profit organization that provides PPE and COVID testing resources really for particularly small, medium-sized businesses, individuals, clinics, really everyone who needs, protective equipment and testing supplies to be able to, remain safe, navigate things at a reasonable price, ensuring, quality and the sourcing of the materials, and irrespective of the amount of purchasing, so everybody can really have access to this. We have a number of partners in fulfilling that mission and making sure that businesses have the tools to, understand risk, know how to navigate mitigation, and really access all the necessary elements to do this and establish testing programs if they're necessary for their organizations. So without delaying further, I'm going to introduce three key guests today. These are three executives in the healthcare space, all women, which is definitely a bonus. And they really, bring unique perspectives from their roles previous to the pandemic in transforming delivery of healthcare and improving care, but also really navigating this accelerated period during the pandemic. So today, three key folks that joining us: Mara Espinal, who leads Healthcare Catalyst Advisors. She's also a faculty member at Arizona State University and a advisor to Rockefeller Foundation in pandemic response. Allison Martin is the CEO and founder of UDO Test, which is now actually a Recuro company acquired recently. So really excited to have you join. And Dr. Nancy Gagliano, and she's the head of NIH RADx Implementation Core. This is an NIH initiative to expand COVID testing that was established early in the pandemic. And she's a former head of CVS Minute Clinic, so brings interesting experiences from that front as well. So thank you so much for joining. How about we open up and we do some more extended intros. Maybe Mara, you can kick us off, and then Allison and Nancy, and from there we move on to some topics of discussion.
Super. Well, it is wonderful to be here. Thank you, Manuel. Thank you, Nancy and Allison. Terrific to be working with you, and really appreciate your leadership getting to this point of the pandemic. I will start with, from my background, I like to call myself, I guess I've been called a diagnostic evangelist, and really believe that there is no way to have the most effective care for patients or most effective public health without clarity and without the tests being a key part of that. A timely and accurate diagnosis is the most important piece to the very best care. That being said, my background is 25 years in the diagnostics business, running Roche Tissue Diagnostics, and before that, Genzyme Genetics. And as you said, I'm proud to be a faculty member at Arizona State University, and in particular, the founder of the Biomedical Diagnostics program, which is all focused on diagnostics as an independent discipline. So very happy to be here and looking forward to our conversation.
Great, thanks, Manuel. From my side, I'm the CEO and founder of You Do Test. I originally started my company actually in South Africa with a focus on cervical cancer and women's prevention many years ago, 8 years ago, and fast forward that crazy journey to the US and been here for 4 years now. Essentially, we've been very proud to work so closely with folks like HHS and the employers we serve at the moment. But essentially, we were selected out of hundreds of companies to be one of 12 that's been working directly with HHS through the pandemic and working closely with them specifically on the rapid OTC COVID test. So our organization, You Do Test, we specialize in the personalization of at-home testing on behalf of enterprises. And most recently, our acquisition by Recuro Health. We are now amplifying that by utilizing integrated data for payers and providers to ultimately change healthcare from being reactive to more proactive through the use of a virtual medical home. I'm also really excited to be here and absolutely honored to be on the call with you guys.
Glad you can join us. Thank you.
And good afternoon, everybody. I'm Nancy Gagliano. As Manuel said, I'm a physician. I started my career at Mass General Hospital, where I spent 21 years as a primary care provider and also a senior vice president. I then spent 6 years or so at CVS Health, where part of our core mission was very much both what Mara and Allison were referring to, is bringing care, access to care out into the community. We focused a lot on point of care testing. So to be able to evaluate a patient and provide them a diagnostic answer at that time, really bringing forth a very different paradigm in healthcare, as opposed to seeing a clinician where you have your test evaluation and then 2 weeks later you find out the answer, is bringing it right into the process of evaluation. And now, as Manuel said, I am a core lead for the RADx Tech program, which is charged by Congress to bring more and more diagnostics out into the market for COVID, with a particular focus on point of care and the home over-the-counter market. So I am very much looking forward to this conversation.
Thank you, Nancy, and thank you, everyone. So if it's okay with you, I'd love to jump into a couple questions that we've heard from a number of folks, primarily in the business community. Maybe you can each share your perspective around, vaccination and mitigation, and really, how does testing fit into this changing environment in this last stage of the pandemic? Maybe we start with Mara and followed by Allison to share some of that as well.
At the beginning, and I'll start with the fact that I hope it's the last stage of the pandemic. And obviously there are reasons to be concerned. Just in the last 24 hours, 46 states reported a 10% increase in cases from last week. Now, it's still small, so we can still get it under control. But I think about it as a 3-stage process for businesses, for schools, for anybody. It's about vaccination, mitigation, and confirmation. Vaccination is obvious. It's great we have 50% of the population vaccinated, and it's terrible we have only 50% of the population vaccinated. It's great we know how to control this. Masks and washing hands, it doesn't cost very much money, but people are fatigued. So, and just plain, fatigued is a fancy word. I would just say they're just sick of it. They're tired of it. So the only way to be 100% sure that the person next to you doesn't have COVID is to test. And the good news, as I'm sure we'll talk about, is testing is faster, easier, and cheaper than it ever has been. So that is my mantra. Vaccinate when you can, continue to mitigate if you can tolerate it, but by all means, confirm through testing.
Completely agree, Mara. So from our side, obviously, with our relationships with some of the nation's biggest employers, we absolutely share your sentiments. So there is a lot of confusion from their side. There was, we've seen ebbs and troughs through COVID and the amount of tests being done. You know, on our side, we did start off obviously with the lab tests, and now very much involved in the super cheap, you know, $10 price rapid tests. And exactly as you say, Mara, there's confusion around the variants. There is, you know, we need to have answers in terms of, are those people safe to come back? How safe do my employees feel? And instilling that feeling in and amongst the workforce, whether it's, you know, whether it's financial services, manufacturing, hospitality, travel, etc. And then another thing on their mind is actually flu season. And obviously, what does that mean? And some of the leading pathologists that we work with, you know, say that flu season is going to be a very interesting one for this year. So what does that mean? And how are employees going to react to that? And is everyone going to think they have a different variant of COVID at that? So yes, agree with you in terms of the vaccinations, but certainly, you know, testing is going to give that clear answer when folks either aren't vaccinated or have got something that they don't know.
I think this is an incredibly challenging time for business leaders.
Yeah.
I mean, in some respect, it almost was easier a year ago, March, because closing down is very clear. You close down, and it was challenging, and people figured out how to keep their business going. And Zoom, I think opening up safely is far more challenging. And then, as Mara was highlighting, you throw onto that the fatigue that everybody has, and the fact that there's so many things that we don't know. And as a business leader, you know, there are legal issues, there are cultural issues, there are political issues, and trying to walk a balance of how do I get as much information from my employees as possible to do things safely? How do I get answers from the CDC and all of the different bodies advising me? And then create an environment that is safe. They can keep their business open and actually think about how to incorporate testing as a potential mitigation strategy, I think is an answer, but also a complicated answer. And I think it's challenging right now for businesses to think about all of these pieces.
And can I add something to that? Because we did a large survey at ASU with the Rockefeller Foundation. And what we found, well, were two things. One, our businesses, as Nancy said, are ready to step up and take a bigger role in the pandemic. As opposed to last year, as you said, Nancy, it was easy for many, many businesses, particularly white collar businesses and businesses they didn't need in person, to just say, go home. Yeah. And everybody worked from home much better than we ever imagined we could or would. But now in our most recent survey of businesses with 250 employees and more, we found 68% were testing at least some part of their workplace. Now that was in March of 2021. We're going to do another survey next month. So we're looking forward to seeing what they expect going forward. We also found that more than 80% said they were going to require vaccinations or encourage vaccinations. So now the question in the fall is, will they go forward and will they continue to do that amidst the COVID fatigue?
Yeah.
Thank you. Very interesting points. I'd love to follow up with some more specific questions towards the end on some of these topics. As a kind of second overarching question, it would be great for the audience to hear some examples of what employers are doing, as they integrate testing into their programs of return to work or work continuity. Maybe Allison, you can kick us off by sharing some of that. We'd love to hear, other perspectives as well.
Yeah, absolutely, Emmanuel. So that's really just been very much a consultative process that we've been helping our clients with, because I think each and every situation has been kind of slightly different. But very broadly speaking, we've had industries such as travel, hospitality, manufacturing, financial services. And the two main kind of use cases that we've identified have been, first off, folks wanting to have safe physical face-to-face meetings again. And whether that's, executives traveling across the country and doing daily rapid testing at their conferences every single morning, that's been one use case in terms of getting out there safely, but really, great testimonials from folks saying that they've never felt safer at a conference before, than using what it is that we provided. The other example is your serial testing. So some employers taking the stance that they haven't inquired about whether the employee is vaccinated yet or not, and then doing regular testing in order to again make them feel safe. But it's low cost antigen testing, but still utilizing our system. It gives them the visibility to see what's going on, and to also make decisions about which branches, or for example, which restaurants, as an example, can stay open and, obviously just welcome customers. The last one is actually, your hospitality industry and customers actually coming back and feeling safe within a retail environment, and not a mandatory test, but absolutely optional and very visible that this is available at certain clients. So it's it varies, but we provide quite a consultative process and get help.
I'll add just two quick things to that. One is, Allison emphasized, is good communication and regular communication, so that employees feel there's no surprises. And speaking of no surprises, the second thing that we've seen most effective and very pervasive in the tech community is a regular process. So they don't have to wonder what's happening this week or what's next week. Some companies have said, well, we'll test when there are broad outbreaks in our community, then they stop testing, and then they want to start again. And that all the data has shown, and the companies that have been most effective with the least amount of time is not changing. You come up with a probably weekly, I would recommend, process. You do it as much as possible, day in, and week out, the same way. And then people almost forget that they're doing it. And it becomes more predictable than this start and stop and start and stop.
Exactly. I mean, we've even had folks, test their employees on a Sunday night before they come in on a Monday morning, and have that kind of visibility before they walk through the door, which is very cool.
Yeah, I think that whole concept of having it part of the normal business flow is really important. As we alluded to earlier, right now, with partially vaccinated and lots of people who were anti-mask in the beginning are using this as an opportunity not to wear masks, and businesses are in a really uncomfortable position. Testing is one of those things that they could set up and require of everybody, and therefore not get into a battle of, oh, he wasn't vaccinated, and therefore why is he not wearing a test, but just have it safe for everybody, without some of the political and cultural battles that might be going on with the maskers and people who are reluctant to be vaccinated. So while somebody has said we're done with COVID, COVID clearly is not done with us. And I know the businesses are very much, the business leaders are very much concerned about that.
Following up on that last point, Nancy, you mentioned concerns, opening it up to the three of you. What are some of the concerns you hear from the business community and other organizations around testing and data and other potential legal aspects?
So I certainly think this is a whole new world for us. I mean, I've been in healthcare long enough to know that it wasn't that long ago that testing 100% of testing was done in a clinician environment. It was ordered by the clinician, read by the clinician, the patient was informed, and it was just nothing anybody really thought about bringing into the mainstream. And now all of a sudden this year, we're talking about testing in schools and testing in businesses. And I'm so thankful of that concept. I think bringing testing out into the community, making it easier to have access to testing, virtual testing, telehealth, there's just so many opportunities that this opens up. However, particularly from a business perspective, there is a lot of question about what's my liability? What am I allowed to do? What am I not allowed to do? If because the policies, the governmental suggestions and policies have changed and been evolving, this has created a lot of confusion among businesses as to, can I require testing? Can I require vaccination? In general, a lot of these are still a little bit fuzzy and up in the air, but I would say that in general, if a business wants to test, they have every right to test and expect testing, and they should be comfortable doing what they believe is the right thing to do from a safety perspective for their employees. It's just terrific that we're actually having this conversation, that other places besides clinical care is starting to get into the mainstream of testing and making this much more accessible for all.
You give me goosebumps, Nancy. It reminds me of some of our rural campaigns where years ago, yes, you know, testing in the home was so new and so unique, and you know, we managed to really save lives in rural areas through those methods, and it's just obviously accelerated exponentially. And I mean, from our side, along with the liability, we've had clients who have been assessed by OSHA, and they have got, you know, a lot of anxiety about that, and essentially the service that we provide obviously gives them a lot of evidence and tools to show that they are doing their best to make their employees feel safe. So that is a huge concern that we can help them with. And the other one is privacy. So giving their employees the option to either share or not share their information with their employer and or anybody else is crucial. And that's certainly also something that we do. The last one obviously was cost. You know, so having you know been doing the testing before COVID for years, but essentially started with the lab testing, you know, very expensive, just completely prohibitive, and then now, yes, the race is to the bottom, very excitingly, but you know, there's still that factor of cost, and folks are still looking at, you know, is that $10 to $20 price point worth it when they haven't been doing it so far? So yeah, very important questions, and as you say, just a huge amount of pressure and stress for these business owners.
I was giving Mara some time in case you wanted to comment. If not, I'll move on.
Said it so perfectly. The only thing I would say is, you know, you guys are experts. We've all spent a lot of time on this. Don't assume your employees understand the logic. You know, back to the communication and spending the additional time to understand it. And maybe this is a silly thing, but I always think about, for my team, what do they need to know and how are they going to explain it to their partner, to their spouse, to their kids, to their mothers and fathers? And then it puts a different spin on it, because then, you know, if they're explaining this is the good thing that happened to me at work today, then you know you're in great shape.
You're absolutely right.
Excellent. Now, as a follow-up to that, Mara, what are some of the resources that are out there for folks to understand some of the nuances, challenges, you know, how to explain things in a simple way to their employees, significant others, or their community?
And most of them are good. not all. So we've all dealt with the misinformation. So I think we have to start with the US government sites, and from CDC, which I give CDC a lot of credit. They are written, maybe in the past the same, but for sure now they are written for everybody and anybody to understand. So they are not written in a complicated way. They're actually not even in small type. I mean, you can just easily go and see the key things. And they even say new guidance here as of this date. The second piece, which is part of the US government that Nancy, you and Manuel know so well and had a lot to do with, when to test, for testing in particular. But if you're looking for broader information, the CDC site, and then you go to test for when to test. I'm biased, but there are also some private and foundations. I think Rockefeller and I, full disclosure, I was a co-author on most of the Rockefeller reports, are good ones. And Arizona State University, our ASU COVIDcommons.com is a great site. But I think industry by industry, it's really important to understand what your industry is doing. So openandsafeschools.org is perfect for school administrators. The National Safety Council would be the other place that I would suggest people go. And you could see what they're doing for all industries, and then get individual sites for specific to the restaurant industry or hospitality or manufacturing, and understand what's happening there. But don't just Google it and find a generic site, because many of them are not accurate.
And if I may follow up on that with you, Allison, in your experience, to what degree does it make a difference for the employer to have that industry specific understanding as they design their programs and incorporate testing?
Absolutely, yeah, for sure, Manuel, in my opinion. I mean, yes, there are those verticals that I mentioned, the three of them, which are pretty broad in general, but employers need as much support as they can get. It's a changing landscape. The calls we have one week is different the next week. We get, literally direct phone calls sometimes from these business owners on an ongoing basis. So as much experience that your testing provider can give you within your industry is crucial, but then the ongoing adaptability and flexibility to suit your needs. So as we've said, start off with lab testing, then it evolved to at-home self-collection lab testing, and now it's point of care and OTC and antigen and all these sorts of things. And then it's, the multiplex testing, it's only, getting far and way more exciting in our world. But the point
and for the audience, multiplex you refer to, Allison?
Yeah, so multiplexing being, the flu A and B as well as COVID within one test, and getting the answer there and then, and knowing what to do in your workforce. So the ever-changing landscape of testing is just crucial that your provider knows. They're aware of what's going on. As Mara said, those resources are essential, but also, the government has been having weekly clinical phone calls. And is your provider on those calls? Are they aware of the latest EUAs, the latest change in guidelines, legislations, etc.? Because even today, we heard some crazy news which changed something again, and we had to advise our clients on that. So it's the flexibility, the adaptability, the knowledge on all the tests that's going on, and then absolutely experience in your industry as much as possible, and that ongoing consultative support, because they need as much help as they can get.
I think, Allison, you raised some really, really important points. Many people who are in the business and other industries have been watching COVID happen kind of through the news, through the media, and what they heard 6-9 months ago may still be what they're thinking about today. And I've definitely run into people who had a deep nasal pharyngeal swab 9 months ago, and they say, I'm never going to have another test, not aware that actually they're pretty rare these days. Most of them are anterior nasal or a little bit deeper. There's some saliva tests. So, that whole area has changed. another thing that has changed that caused, I think, tremendous confusion in the beginning was there was this myth that only a molecular test is a good test and that antigen tests are terrible. And I think science had to catch up and communication had to catch up to really realize and understand and explain that, yes, while the molecular tests that you get in the big fancy labs that often take a day or two are very accurate because they can pick up viruses at a low level, the antigen tests, if you do them serially or frequently, can pick up the virus as it's climbing at a slightly higher level, but they're really good. And just because they're less expensive doesn't mean that they're worthless. So, there's some core elements of information that we hope that the average person has learned over the course of time, but we can't assume it. And it's really important to reinforce a lot of these key messages where testing now is easier, is far less expensive. Just because maybe 6 months ago you looked at it and said, I couldn't possibly do it, or my employees wouldn't. There's so many more options now that it is a good time to take a second look and say, is this something that is going to help me keep my business open? And the other thing I want to say is one of the core things that I think we all learned is, in retrospect, if we were able to get testing out quicker, sooner, faster, better, so many of the businesses that had to close really didn't need to close. And, hopefully we've learned a really important lesson that if we as a country can get testing out there much faster, we probably could have kept a lot of our businesses open much more effectively.
Yeah, and Nancy, that is such an important point. And I want to emphasize that why are we testing? We're not testing just to count the numbers of people. We're testing to find people who have the disease and therefore need to quarantine. It's not testing for the sake of it. It's testing for a purpose. And why is that so important? Nancy, you know far more about infectious disease than I do, but I don't think there are many diseases that 40 to 60% of people are completely asymptomatic. Like my 90-year-old mother who had COVID and 0 symptoms, but almost certainly spread it to others because she had so few symptoms and at the time couldn't get a test in New York. So I think that's a key piece of it. The other piece that I would add, as you said, Nancy, for people to go back and look at testing, and Allison said to think about flu testing, use Project N95 or the FDA site to make sure the tests you're buying are legitimate, or the test company you're working with are legitimate. Because the more this went on, sort of like masks and otherwise, there are now people doing, I don't want to say, well, fake test is probably accurate. I mean, the FDA has issued 4 safety warnings for companies that didn't even get an EUA but are claiming it.
You're right.
And there's no way to generalize what these companies look like. They look like all sorts of things and they look pretty good. But ensure if you're going to test that it is a test that has the qualifications it says it has.
That's really, really important. Along the line, this is a little bit soapboxy, but I think this is one of the first times in our history that science has been learning as the COVID has been evolving. And this is one of the first times that I think the public has gotten some distrust of science because science didn't have the answers. And as we learned, we provided new information, which felt contradictory or confusing and misleading. So I remember way in the beginning when we weren't wearing masks, and I, as a physician, we're telling people, no, you don't need to wear a mask. You wear a mask if you have the disease. And then, as Mara said, oh my goodness, this disease, so many people are asymptomatic, so we have to wear masks. And in the beginning, variants weren't a problem because this type of a virus was very stable. Now variants are a problem. So the message from the scientists keep changing, therefore adding to the confusion as well as a little bit of mistrust. And that's, I think, very challenging when you have a sense that what they tell you today is going to be different from 3 months from now. Yeah. But in this case, I think we just have to reassure people, yes, it will be different in 3 months. So stay tuned, pay attention, because we might be providing additional, more specific, more clear recommendations.
You're right.
Thank you, Nancy, for clarifying that point. I think we've heard a lot from employers, from individuals, things along those themes of, well, I heard this, and now they're saying the opposite. Why? And they don't get that. So it has created a lot of confusion. Completely agree with your point. Maybe in the sake of time, I wanted to kind of move on to a couple of areas, and you can comment as you see fit. We don't necessarily have to go, all around, but one of the key things we've heard is, okay, so what are the elements of a good program, that incorporate testing, that's kind of appropriate for where we are today, right? And I don't know, Nancy, if you want to comment, or yeah. Allison, maybe you want to, interject.
I'll start and then obviously turn it over. So one of the things in that vein of we've heard different things and it seems to change is I noticed early on this concept of wear masks, socially distant, as a complete separate conversation to testing. We didn't have enough testing, where it all goes hand in hand. There are what we would call mitigation strategies to help reduce the spread. And so wearing masks and getting vaccinated and doing contact tracing to isolate people who are known to be exposed, as well as testing to identify asymptomatic people who might then spread the disease, all should be thought of together. So, my recommendation for a business is to really look at the whole totality of what are the things they can do to mitigate their risks. As we said, it was early in the beginning, just don't go to work. Now we want to stay open. We shouldn't just do testing or just do vaccination. It's look at the whole entity. And I'll just throw in a plug, and that's one of the things that we tried to accomplish with the whentotest.org website, which is to show you how all your mitigation strategies work together to come up with a robust plan of putting it all together and devising a testing program that actually might work for your particular environment.
Love it.
Thank you.
Wow, that's incredible. And I think to add on to what you said, Nancy, I think from our side and the experience that we've seen and the conversations that we have, it would definitely be that adaptability and the ability to move fast in these changes, but also support employers and the need for them to adapt to the change. The flexibility, it would be that support. So the ongoing support and consultation. And have you got a partner in this, or have you got a vendor in this? And then the last one I would say would be I'm losing my train of thinking. It would be the visibility. So as the employer, is the employer empowered with the visibility on what's happening in their testing program? Obviously I agree with Nancy on the combination being essential, and as with many other diseases that we have experience with, but have they got visibility? Are they empowered with the data to show what they should do next? Are we solving an actual problem, or are we just throwing tests out there? And then make sure that the data you're collecting through tests and other sources is solving your problem to stay productive, stay open, and meet that need of yours.
And that's right. Now, I'll just add one thing on it, which I love, the Swiss cheese analogy. Realistically, whether it's at this point or any point, most businesses are not going to do every one of the mitigation measures. You may not be able to change your ventilation system, and you may not be able to have 6-foot distances or 3-foot distances between people, because if you have that much distance, why are you back in the office at all? You may not want a mask every day. But if you think about that, as Nancy and Allison described, as a holistic approach, if you want to do none of those and you test every week, then you're probably fine. If you want to do all of those, then maybe you test a little less frequently. So it's the balance of those in terms of the Swiss cheese. You don't want to align all those holes so the virus gets through. And think about what are the ones that work best for you. If you're in a business that interacts with the public all the time, you might want to have those front-facing people wear masks. But maybe the others who have all been vaccinated, you don't need to. So think about what works for you, but think about that Swiss cheese approach. You don't need all of the layers, but you don't need 0 of the layers to be safe. And as I think Allison said at the beginning, confident and comfortable. We want to reopen, but sustainably reopen, not get an outbreak and have to close.
Yeah.
Thank you. And, following up on your last comment, Mara, it seems that you're hinting towards stratifying. Maybe there's different groups in your organization that require different measures, and maybe even if you're testing in at different frequencies as well. Any examples any of you would want to offer around that briefly?
And this forward facing is a key piece. So we've seen a number of manufacturing companies where the customer service people, several folks have said, you're required, if you want to work customer service at the front desk, you need to be vaccinated and you need to wear a mask. Particularly for companies, even though most of the healthcare costs are being paid by the federal government still, it's not going to continue forever. Manufacturing people need to either wear a mask or get vaccinated. So they have some more flexibility, but it's very difficult to be 3 feet apart. And white collar people, traditional business in their own offices can choose. But if they're going to, go to the coffee station, they wear a mask. But otherwise, even if this business I'm thinking about, even if they're walking in the hallway, as long as they're moving, they don't need to wear a mask. So find that balance that works for you. I also like some of the companies that have decided not to test regularly because they have a young population or they have a highly vaccinated, but they're still doing occasional once a month random testing. And that ensures everybody is comfortable. So that's one of the models that I've heard, a relatively large manufacturer that is trying to balance its cost versus safety. And we have to recognize the cost is a piece of it. And they thought that this was a good balance in doing it.
Thank you. So I think, would love to get maybe some final thoughts from you. Go around, and as you think about that, maybe throw in a tidbit of what have you learned, or what would you hope that remains from our learnings from this experience? Try to extract a little bit of the good of the pandemic, let's say in that way. So don't know, maybe Mara, you'd like to lead, or Nancy or Allison, but just maybe a couple of minutes of your final thoughts would be really appreciated.
Want me to start?
But
Okay, the tough one here. Well, some of them are not controllable, but I'm going to start with that, which is, it would be nice to not politicize health. I'm not naive, and maybe if it happened again, we would do it again. But this is maybe a silly word, and I say this in a very personal way. I lost 6 friends and family members to COVID, all early. and only 2 of the 6 were over 70. So this was not just old people. And so I say this with all respect for so many, actually, I literally get emotional. I say this with all respect for so many people who have lost loved ones. It doesn't matter what your politics are. People really need to work together to figure this out, because the virus doesn't care and doesn't know. And it's trying to keep itself alive, which is why we have more and more variants. And I believe we will continue to have variants until we either get more of the population vaccinated or somehow it rolls out of steam. But something that has a 2 to 3% or 1 to 3% death rate typically doesn't run out of steam. It's probably going to be with us forever. So I think that's the first thing. The second thing is to be more transparent with our conversations. I think the public health people did as much as they could, but to be able to say that this is what we know and this is what we don't know. I think we suffered a little bit from assuming we were pretty much sure. And Nancy talked about this earlier, and it changed, and that undermined confidence, even separate from politics, undermined confidence of all of us. Lastly, personally, and I guess I had 3 things on a macro level as opposed to micro, is I think industry has shown that it can work responsibly and with government. So bringing in industry, like we did with the vaccines, in a stronger way, and doing it for testing, bringing in people to do it well earlier is a great idea. And if we end up with a few false alarms because the next one doesn't expand like COVID-19 has, that's fine. Let's get that ability to work together and get the best brains in a room with no egos sooner, and not just on cures or treatments, but include testing as part of that process.
Thank you.
To build on what Mara said, so I absolutely 100% agree and would like to say did to everything Mara just said. To build on it a little bit, from a healthcare perspective, I mentioned this earlier, I think we have an incredible opportunity to use this as a way to fundamentally change healthcare. We've been talking about telehealth being an opportunity for so many years, and there's so many reasons why it's been challenging. And the lack of diagnostics integrated with telehealth has been one of the huge challenges. And I think this has created an opportunity to bring virtual care with diagnostics to the forefront. And I really, really hope we don't lose the momentum, because I think we're just scratching the surface of what can happen. And it is probably more in the consumer's interest to have this be more open to them, to make it easier and more accessible and less expensive. And you don't have to take the day off from work to see your provider. So I really hope this is a new step into accessible, affordable healthcare. The other is I'd like to build a little bit onto what Mara said. Having been involved in RADx, which is an NIH-sponsored program that has brought industry and academia together to develop tests in an unprecedented way, in the fastest possible way to get diagnostics on the market, has been truly extraordinary. I have never had the opportunity to work so deeply with government. And one of the things I can honestly say is there are phenomenal people in the CDC and the FDA and the DOD and in NIH and NIBIB. And golly, people are working and have worked this last year as hard as possible. But I think bringing industry and some deep experience in practicality of commercialization to these organizations, and having these organizations work together in a way they haven't, has been really phenomenal. And I think all of the government agencies that I've been working with are hopeful that this is a new beginning of much more inter-agency collaboration, as well as partnerships with more commercial businesses and academia. So I think those 2 things which are not related to the pandemic, I'm really hopeful we'll be able to carry on.
Yeah, I completely agree. On our side, we've just got so much gratitude and so much appreciation and deep respect for the people that we've had the privilege of working with so intimately with at RADx and HHS during this process. The amount of hours and pain and just dedication that we've seen has been unprecedented. So I absolutely can echo what you say, Nancy, and truly from the bottom of our hearts, thank those folks tremendously. I think the one other thing I wanted to add, Nancy, onto what you said is not only the emphasis and the adoption of telehealth, but it's also the focus on healthcare. And it's from the employer's perspective. So it's them realizing, and they always did, but now it's at the forefront, and now it's like, hang on, this is something we actually really need to look at and take care of. So that level of conversation is now so much more easier for us to have with really, really senior people at these organizations, because if you don't have a healthy workforce, it's absolutely impacting your bottom line. And if you're not doing everything to make your employees feel safe, it's absolutely impacting your bottom line. And let's hope that we've learned some important lessons and we don't have to repeat any of them anytime soon.
Thank you, Alison. And thank you, everyone. I think, a lot of food for thought here. Thank you for sharing, your experiences, your expertise, your perspective on these topics. We hope that this is, very, useful and appropriate for businesses that are engaged in the audience. We'll post additional information and links so you can learn more, follow up as needed in the notes when the webinar publishes. But I want to thank you so much for your participation today and for sharing your time with us. So thank you.